It's a special place where your dreams all come true. Fly away with the oceans. Good morning, everyone. Y'all can do better than that. Good morning, everyone. Thank you. Buenos dias. Excelente. How's everybody feeling? So my name is Julie. I'm part of the Envision team. Yesterday I coordinated a little dance party. Can I get some shout outs from whoever went to the dance party? Y'all, that dance party was fun. I know Zumba was fun. Some folks needed to meditate. Yeah, so who had a good time yesterday? Y'all are amazing. All right, so today is our last day together. I have a few announcements, and then we have an amazing panel coming up that you're going to be really interested in. For anybody who needs to store some luggage, if you're checking out today and you need to store some luggage, room 1 is reserved for us to put luggage in. So room 1, if anybody needs to check out of your room and do that. Also, a reminder to teams, don't forget to do your quilt piece. In the craft room, there are instructions, there are ways to do your quilt piece. We want to make sure your team is represented in our quilt. So make sure you do that. All right, here's something fun too. These table tents that everybody sees on your table, cute little table tents with sayings, those are for you guys to take home. Those home. Also, around the wall, you see some of our Envision quilt pieces that are stuck on the wall out here, out in the hallway. Those have light sticky on them. So you can take those home. If you take one, stick it to the back of the other one, take that home. Enjoy it. We want you guys to have those. All right, another important announcement. On your tables, you see some cards with 2 QR codes on them. Sherry right down here is holding one up. Everybody look on your table. There are these cards. Thank you. Thank you. Those cards are very, very important. They are our only evaluation for this whole summit. We tried to be evaluation light, tried to make you not do a bunch of surveys and paperwork and all of that because you do enough of that already. But we need to hear from you in this one evaluation. There's one QR code for English, another one for Spanish. So please take the time today before you leave, click on the QR code and do the evaluation and let us know how we did for this summit. All right, I think that's it with announcements. Super excited what we've got coming up right now. If y'all will look at the screens, today's theme is growth. And what better way to start the day talking about growth than to hear and see from some of you guys. So we've got a photo voice slideshow from our photo voice session yesterday from some of you guys. So without further ado. Don't believe in all that you've been told. Sky's the limit, you can reach your goal. No one knows what the future holds. There ain't nothing you can be. There's no more that you see. Climb every mountain, reach for the moon, follow that rainbow. In your dream. Awesome. That was beautiful. Thanks to everybody who participated in that. That was beautiful. All right. So now what we have for you guys is a panel of 3 amazing folks that I'm going to introduce to y'all. So first we have, many of you guys know her, my friend, colleague, Honey Yang Estrada. I think you have some fans. Honey Yang Estrada is the president of the North Carolina Community Health Worker Association. She was born in Fresno, California, and moved to North Carolina when she was 11 years old. The daughter of Hmong immigrants who sought refuge in the United States during times of war, Honey understands the struggles families face in navigating various societal systems and the existing barriers that inhibits them from achieving positive outcomes. A proud community health worker, Honey has worked in healthcare and public health for over 20 years. Her experience is rooted in community health and advocacy. Throughout her career, Honey continues to serve as a catalyst for change, where she champions racial and health equity. Give it up for Honey one more time. Awesome. Next, we have Margaret Maggie Sauer. Give it up for Maggie. Maggie joined DHHS's Office of Rural Health, which is in North Carolina, as director in June 2017. She has served in a variety of settings, including clinical, academic, and nonprofit leadership. She's worked in direct patient care or administration for her entire career. Prior to Sauer's work with nonprofit organizations, she served as the director of health promotion and disease at Duke University and disease prevention at Duke University, and as a research assistant professor in speech and hearing sciences at the University of North Carolina School of Medicine and Allied Health Sciences. While she is a native of Colorado, North Carolina has been her home for over 30 years, and her family shares an early history in North Carolina. She grew up on the rural eastern plains of Colorado and credits her childhood experiences for her passion to serve and work in rural communities. So thank you, Maggie, for being here. And last but certainly not least, many of you have probably got to meet Lucas Allen. I love the energy, y'all. All right, Lucas Allen is the advocacy lead for federal and state policy at Partners in Health United States, where he leads U.S. advocacy efforts to support community health workers and public health leaders in building strong community-led health systems. Before joining PIHUS, he worked with the American Academy of Pediatrics federal advocacy team to restore federal funding for gun violence prevention research, ban dangerous children's products, and advance other children's health priorities. Lucas holds an MPH in health policy from George Washington University and a BA in international studies from Boston College. So again, help me welcome Lucas to the stage. All right, I'm handing it over to you, honey. All right. Yo, what's happening? Yes. All right. Shout out to the North Carolina team over here.
Shout out to everybody joining us on Zoom. Yes, I proudly represent North Carolina, and there are so many team members who are not here with us today. Many of you are with us on Zoom, so shout out to our North Carolina team back at home. We love you guys. So yes, good morning, ¿cómo te va? And in my language, we say, "Nya zhong shen za." "Nya zhong shen za," Hongxi, I hear you. All right, so I am so honored that I get to do this work alongside so many amazing partners. And to set the stage, Maggie and I are going to tell a little bit of a story. So we're going to talk a little bit about what this movement has looked like for us in North Carolina, because today it's all about growth, right? And I'm standing because I can't see this side of the room, so I want to make sure that I see everybody. Today it's all about growth. And I am so proud of the movement and the growth that we have built in North Carolina. So thank you for sharing this space with us. Thank you for inviting us to share a little bit about what we're doing. And we hope that this will inspire us as we continue the movement together. Okay, so next slide, we can go ahead and advance to the next slide. So Maggie, you want to tell us a little bit about how this movement started? There you go. Just so y'all know, the mics are like really hard to get out of these things.
Can you hear me now? Yes? Okay. All right. Perfect. Y'all, I come here with a full heart and just want to say thank you for including us in this monumental moment. And I sit amongst people who I believe all of you are the ones who make the real difference every day in people's health. It's you. And what I would like to also acknowledge is that, you know, at the heart of everything, I'm a woman who came from rural Colorado, and I had a grandmother whose name is Lizzie Sauer, who was in the day would have been called a community health worker, because if anybody in the community had anything that needed to be done, they called Lizzie, and Lizzie showed up. So, you know, our office, I grew up in understanding that community was probably the most important element in really making a difference in people's lives. And I say that because that is, you know, we come to this work through our roots, right? We all have roots in this work and why we do the work, and we're all grounded. You know, I love our team's members from North Carolina. Could never do, I mean, they make me cry every day, you know, just because I love them so much. But what I wanted to begin to do was to say thank you to all of you. I'm humbled. I also want to say thank you to Bree from CDC, who has been helping lead us through this journey. And Robert Greathouse, who's not here, but helping us pivot and adjust to the things that need to be done. And I also want to say thank you to PIH, because every single slide you're going to see PIH created. Okay. So we would not have the 2109 without PIH. I will also tell you that they created opportunities when we had a response to COVID where we were talking to the secretary every day. So let me get with it here. I'm saying thank you, and I got 2 minutes, and I've got more stories to tell, so I apologize. Okay, so we're talking about growth, the things that are in the soil. I'm a gardener. So the things that were in the soil when this movement happened, Tish Singletary in 2014 is the person who helped get this moving and creating these opportunities. It was her work in the community that began to move us forward. There were draft recommendations that came from the community meetings that she held across the state. So the point here is that because of that, when Dr. Mandy Cohen came to North Carolina as the Secretary of Health and Human Services, she believed in this work and put it in our 1115 waiver. Okay. So we had fertile ground to begin looking at this. And then as we move forward, certainly the association was beginning to create those opportunities and things in the community. You want to talk about the CC, the community college and the standardized curriculum?
Yeah, absolutely, Maggie. So for, in 2019, we pulled together a team of community health workers from across the state. And at that time, we were known as the North Carolina Community Health Worker Advisory Committee. It was the first time ever that we had a group of CHWs guiding the work. Tish called me and said, honey, do you want to chair this? And I was like, I ain't never been no chair of no state, nothing ever in my entire life. What? So I reluctantly agreed. And during that time, we had two CHW leaders who had co-developed what we call in North Carolina, our standardized core competency training, AKA SCCT. Proud to say that today it is delivered through 14 of our community colleges, 2 of which deliver the curriculum in Spanish for our promotores de salud. So you can shout it out, you can clap that up. Right. And so just super excited because to see where it was when we started to where we are today, and really proud of the fact that in North Carolina, the CHW Association owns the process from start to finish. For us, by us. We own the training, we own the curriculum, we own certification. Over 1,100 certified CHWs today.
And I think the other thing you were going to say too, honey, might be that this happened because there was a convergence, right? All of the work that you saw before happened before the pandemic. And we decided that we also in the office wanted to create a statewide coordinator, a community health worker coordinator, and Monica Midget is here.
Monica.
Yeah, for that. So that, because that was part of the core. But importantly, during the CDC pandemic, or sorry, the COVID-19 pandemic, we required that people, the agencies that were given money, so there were over 500 community health workers that were hired during the pandemic, over 3 million touches. I mean, I cannot tell you, the state would have never done any of that. But what I will say is we required those agencies to pay $20 an hour. And we also required them to pay for the training and the certification.
Okay, so I want to say something about that right now, Maggie. Okay, because do you hear what she just said? This is policy in action. The state required the vendors to pay an equitable wage. The state required the vendors to pay for training. The state required the vendors to pay for certification. All right. So this was really innovative during that time because I was really humbled that, okay, all right, we got something, right? And this really was what jump-started us in building this infrastructure inside of North Carolina. So thank you, Maggie, for spearheading that.
Thank you for creating the guidance. So I would just say that the document that was created, which was the blueprint from North Carolina, came from Honey's work and Tish's work in the community. So when the pandemic hit, we were ready to go. Okay. We had to go fast. We made a lot of mistakes. I always say across the board here, we're like siblings. We argue, we fight. It's like, why are you doing that? Well, why are you doing that? Blah, blah, blah. And there's a level of trust there. And I always say to Honey, it's like, there are certain things I would love to do. And I'm in an agency where I can't always do it the way that I would want to do it. So we have our discussions.
Yeah. And I say to Maggie, okay, Well, then tell me what we can do and I can push from the outside, right? So CHWs in the room, hear me on this. As we're working with our state partners, it's going to be really critical for us to understand what the state can do, what they can't do, what we can do.
Yeah. So thank you for that. Quickly, we'll go to the next slide because the next slide, there should be a slide in there that talks about our partners. Okay, well, we have lots of partners. You'll see them in the final deck.
Yeah.
But we have a lot of partners. So where we are right now, in terms of going forward and working with the Community Health Worker Association, all of this work is now happening. We want to be supportive and we want to work back through the association. So anything we can promote, we want to do that. We don't want to hold that, but we do want a tie with our community health worker coordinator in the office in DHHS to stay connected. Okay. Where this is landing now, and I've learned so much, y'all, at this meeting, is that we have a Medicaid system that basically does not, we were hoping that the payment bundle people would use to actually hire community health workers in our managed care environment, right? We're not seeing that happen as much as we'd like that to happen. But the other part of that is a healthy opportunity pilot that includes specifically payment for food, transportation, housing, and prevention violence or prevention support in violence. So all of that can be wrapped into those healthy opportunity pilots. So now we've got a demonstration and we also have Medicare that I think will serve the community health workers trying to gain sustainability in North Carolina.
Yeah, thank you, Maggie. So as we look ahead, what's up for North Carolina? What you see on the map is a map of our regions. All right. And so this map is really critical because as we think about growth and sustainability, it's going to be really critical that we engage our CHWs where they are. And when we talk about movement building, we talked to several CHWs who said, yes, it's great that we have a state association. We also need some help a little bit closer to home. All right. So this is how we are going to build a sustainable framework for our CHWs back home. When we talk about growth and movement building, what we did, and I'm going to intro Lucas here in just a second, but what we did is we took a look at our CHWs, the spread of our workforce across the state. We divvied them up by region, and then we got super granular and dug deep into where they are in the districts and which legislator represents them to start building a coalition of CHW leaders who can help us drive this message home. I'm going to skip the slide. All right, Lucas. So let's talk about educating decision makers.
Good morning, everybody. How's everyone doing? Last day. Okay, so I'll just say a minute about who is Partners in Health. So we're the US arm of the global nonprofit Partners in Health, founded by Dr. Paul Farmer, Ophelia Dahl in the 1980s in Haiti. We work with over 10,000 community health workers all around the world in 11 different countries where we work. Our mission is health as a human right. And we see community health workers are the core of our work. In the United States, we are a proud CHW ally organization. So we work really closely with Honey. We work with Maggie. We work in 7, and Honey, if we could go to the next slide, we work in 7 different specific places, including the state of North Carolina on programs. And then I and my colleague Allie here, who many of you know, we lead our advocacy work. So it's not just in the 7 places where we work. How do we partner and support the leadership of Honey and community leaders? But how do we change the systems and the structures, and how do we partner with health workers leading this movement to support that growth. And this is all about educating decision makers, because that is the power to create change. As Denise said on day one, we have a problem and we have the power to change that problem, and we can educate our decision makers. And we've heard, I am so grateful for hearing, we've pulled back the curtain on this relationship, the sisters of working with an agency and a community health worker association. And then I'm also excited to turn it back to Honey to talk about the legislators who have the power of the purse, right? They control the budgets. In Congress, they're working on the national budget this week while we're meeting here. So I'm excited to hear more from Honey about how that's gone in the state of North Carolina.
All right, thank you, Lucas. I'm going to stand for this part because I'm really missing this side of the room. Stand, yeah. So in North Carolina, last year we had our first ever education day in North Carolina, and many of you have heard me tell this story, right? So I told the planning team, I'm going to be really excited if we get like 10 or 20 CHWs to show up. I'll be really excited if we can get that many. Y'all, over 80 CHWs showed up. What's that? In 3 weeks. Yes, Allie says in 3 weeks, right? We had less than a month to plan. We were working at a rapid pace. Over 80 CHWs showed up to educate decision makers. That tells me that CHWs, we are hungry for change. We are hungry to continue this movement. Right? And we showed up, and there was a lot of work that was done, right? I talked a little bit about how we took every CHW and we drilled down to the district to say, who is your legislator? Who is that decision maker? Hey, CHWs, are you ready to have this conversation with your decision maker? Many who were scared, myself, okay, I was shaking in my skirt. I was wearing a skirt the first time I ever sat across from a legislator, right? I remember those early conversations with Lucas and Allie, and a lot of coaching to what to say. Most importantly, what not to say. And I was shaking in my skirt because I've never done this before, right? I'm a CHW. I've never done this before. I've never had to talk to this big, far away decision maker up at the Capitol. I've never done that before. So it's a lot of coaching and a lot of role playing over and over again to get to that table with the decision makers to have that conversation. Over 80 last year. We have our next one coming up this May. So if you're at home in North Carolina watching, I expect to see you there. All right. And we're really excited about what's happening in North Carolina. I know just last week, I heard from one of our colleagues, one of our partners back home, that one of our most conservative senators said we need more CHWs. And I could not have been more proud. And that speaks to the fact that CHWs are leading in this space, that we are building this movement, that people see us. I see you. I see you. I see all of you. Now they see us too. All right. And so at the state level, yes, we're doing this. We're also doing this at the national level. All right. And so we're going to be in a workshop a little bit later. We're going to dig deep into what this really looks like. So if you want to learn more, come join our workshop later. I'll be in there with Allie and Lucas and Leslie. But what I want to stress here, especially for our CHWs who are newer in this space, is that these relationships take time. It happens over time. It is one conversation, another conversation, an email, a follow-up, another follow-up. They may not email me back. And a month later, guess what? I'm like, hey, it's me again. It's me again. Remember me, the CHW from North Carolina? But those relationships have delivered some really amazing results. Okay, so this work is hard. And I'm not going to lie to you, it's hard. It takes tenacity. We got to dig deep, my friends. We got to dig deep because we are doing this for us, by us. And in order for us to get the results we want, We've got to dig deep and hang on, and it does not happen overnight. Okay. And so, Lucas, you want to talk parts of a meeting and what that looks like?
You mentioned the coaching, honey.
Yes.
And again, we're gonna dive deep into this in the workshop. But I got like emotional hearing you talk about that first meeting and the nerves, because it can be intimidating, right, to enter these spaces. But community health workers are amazing at this. Like, this is what you do. I've done this work with other health professionals, and you all are the best at it. I can say that confidently, because you know your communities, right? You work with, you build relationships, and that's what it's all about, right? It's about, we have the data, right? We can marshal the data, but the stories, the community trust that you all bring, legislators need to hear that. Legislative staff need to hear that. The last slide had a picture of some community health workers. Shout out to the Florida CHW Coalition. They did an advocacy, they did a education day in December, and they met with the Senate president herself. And she said, I've never heard of community health workers before. I'm so glad I know about you now. And she's working on a health workforce bill to expand the workforce and to serve underserved communities. And she didn't know about CHWs. So this education, the growth of more community health workers educating decision makers, that is building power, that is building the movement. And so just to peel back the curtain again on some of the coaching that we do, the power mapping, and it's not just the days, the big education day at the Capitol, right? It's every week meeting, talking about our strategy, building those grassroots leaders in each of those Medicaid regions from the slide you showed. And Honey's been amazing at that. And everyone, the best meeting I've ever been in was last month in DC with Honey. I've never seen a meeting like that. So if you want to talk about some of the national advocacy you've done too.
I can. Yeah. Thank you, Lucas. So the senator for our state, y'all, I've been working this office like for a minute. Okay. I've been working this office for a minute. And we had a really great, so let me just preface this by saying that when we initially said we were going to go to DC, they didn't have time on the calendar for us. They had a booked day. But the staffer said, hey, can you come at 4:30? And I said, sure. Because I told him, I said, I'd love to see you. I'm coming. I'd love to see you in person. And he said, sure. He said, let me see if I can move some things around. Can you come at 4:30? Okay. He's like, we've got like 20 or 30 minutes. I said, okay. We spent almost an hour in his office. Okay. Because I built that relationship. Yes, Allie, because I continued to have conversations with him over and over. And what that has led to, and again, we'll peel back the curtain on this, as Lucas said, we'll talk about this a little bit in our workshop. But what that has led to is he said, we've got some congressional directed spending applications coming up. We would love for the association to apply for some funding through congressional directed spending. Okay, my friends, this is the power of relationship building. All right, this is the power of relationship building. And again, it doesn't happen overnight. It's not one meeting, it is multiple meetings over and over again. So I know we're running short on time because Susan keeps looking at me. Am I good? I'm good? Okay. You know, and CHW is like, we have to like get all the context in, right? We got to tell all the details. We got to give all the context. I can be long-winded. I know that. But right here, we've got here a slide on allies, an authentic partnership. So before I get into this, and when I say decision makers, I'm talking about our legislators, but let's take that down just a notch. All right. So we are in a space with lots of CHWs and lots of allies, right? Many of our state health departments are here today. So if you have ever been in conversation with a decision maker, whether that's a legislator, whether that's somebody at the state office, and you were told no, stand up. Okay. You see that? Look around. Okay. Thank you. Thank you. If you have ever been in a conversation with a decision maker, whether that's a legislator or somebody from the state office or your manager or your boss, and you were told no, stand up. Uh-huh. Yep. Yep. See? Yep. Stand up. Right? Thank you. What's that? I'm hearing what? And so what I want to say here is, did you stop? All right. Just because you were told no, did you stop? No, right? You get back up and you keep going. I have made every single mistake in the book, my friends. I have tripped on every single wire that there is to trip on. Maggie and I have had super tense conversations. I know I've been mad at her. I know she's probably been super frustrated with me, right? No. And not honey, right? I know we have, because, I don't know how to stop. But this speaks what I want to speak to, my friends, especially if you are an ally in this space. And I've heard it over and over again from our allies who have said, I want to show up authentically. I want to support the work. And I'm going to peel back the curtain. I really like how Lucas is saying that. I'm borrowing that, Lucas. I'm going to peel back the curtain a little bit into the dynamic of this relationship that I have with Maggie. It's not easy. It's hard. It's freaking hard as heck. Okay. We get mad. Yep. You can clap it up. I know. You can clap it up. It's okay. We get frustrated with each other. We get mad at each other. And, just this week, Maggie and I had a really honest conversation. And she said, I don't want to tell you what to do. And I said to her, you're not telling me what to do. Do you understand that because you have power and you have authority, you see things differently than I do? You have a seat at a different table. You have insight. You have feedback. You have guidance. And as a CHW leader, I need that feedback. I need that guidance to lead this team of CHWs, to lead this movement to the next spot in the journey, right? I need that. So CHW leaders, if you're here with us today, I need you to hear me on this. We need our allies. Allies, I need you to show up with authenticity. I need you to listen, and it does not happen overnight. And I am going to say this with my whole entire chest. I'm going to keep it, as Elisa Quarles from back home would say, I'm going to keep it 1,000 with you right now. All right? So stay with me. I know that I had this conversation with Maggie, and she said, I want our team to be able to push back. She said, I know that I am a director, and I know that sometimes what I can say can be taken as it's the Holy Grail. And I said, because you're the director and you're the boss. Take a look around. So many CHWs are people of color. So many CHWs are women of color. Right? I hear you, Denise. I hear you. Women of color, people of color who have been told, sit down, shut up, do your job, don't make moves. Okay? So how is it that you're telling me that you want me to push back when all my life I've been oppressed? I can't do that. It is a trauma response because you are the director, you are the decision maker, and I'm coming with all of my history, with all of my trauma, with my lived experience. Okay? And you're asking me to sit down with you and have this honest conversation, and I can't because I'm scared. My friends, it takes a great amount of courage and vulnerability to be brave. We talk about brave, safe spaces. Is it really brave? Is it really safe? Right? I am shaking I'm wearing jeans today. I'm shaking in my jeans and in my sneakers every day when I have to have these conversations, because I've never had the power to say, I don't like that. And the first time I had to do that, y'all, let me just tell you, the first time, you remember when TTT blew up, when Train the Trainer blew up? Real life story here, okay? We had it was in the middle of COVID. It was in the middle of COVID, and we were trying to build some things, and CHWs were coming to me saying, this doesn't feel good. We need it to stop. And I was so scared. I'm like, well, they're the decision makers here. They've got all the power, all the resources. And I was scared, but I said, okay, let's do it. We sent a letter, we postponed the training, and everything blew up the next day. We got into a meeting. It was tense, but I stood strong, because here is the deal, my friends. If I don't do it, who else is going to do it? And so for the allies in this space, I want you to hear me on this. And that when you say you want to show up authentically to further this movement, to grow this movement, it doesn't look like coming to one meeting and listening. It doesn't look like saying, let me tell you, let me hear what you have to say. It looks like you showing up and listening and delivering on what you said you were going to do, not once, not twice, but over and over and over again. It looks like you actually allowing CHWs to lead, because we can do it, right? We know what our communities need. So CHWs, my call to action for you, or CHW allies, my call to action for you today is to recognize the power and the privilege that you hold. All right. And so for my CHWs, and I know Susan is giving me the time card here, but I want to say this for us as CHWs. No shade to you, Susan. Okay. This work is hard, my friends. And I've heard from so many CHW leaders who have said to me, how do I continue to do this without losing who I am? Without losing my authentic self in this space? And I will tell you, it's freaking hard. I have cried tears. I have sat and I've been frustrated. I've been pissed off. If we don't, I know. If we don't show up and create the space that we want, create the world that we want, they're going to do it for us. Okay? So CHW leaders, I want you to step into this space. Get comfortable with being uncomfortable. You have power in yourself. CHWs, you have the power in yourself. For a long time, I didn't think I had it. And listen, okay, I get it. I've said this as the state association lead. I don't have a boss. I have my board and I have CHWs that I report back to. They are my bosses. They tell me what to do. I'm accountable to them. For many of you, I know that you are within a system. You can't say the things you want to say. So for right now, I'm going to plug our state associations. If you're not involved in your state association, as a CHW association network lead, I need those voices at the table. I need to hear from you, because here's the deal, guys. As a state association lead, I can be that voice for you. I can stand in the gap for you. I can say all the things that you need to say. All right? But I can't do that if I don't hear from you. And you hold me accountable so that I don't lose myself in the process, and that I don't fall into this wheel, this broken wheel of the system. I need you to hold me accountable. So CHWs, my friends, rise up. This is your movement. Our time is now. Thank you.